We've all become accustomed to wearing masks on a daily basis, which of course was an intervention to help curb the spread of COVID-19. But could this mean that we're heading towards a new dry eye epidemic as a result of mask wearing? Well, we have in studio Dr. Paulo to give us some more information on this possibility. Now, Paulo, it seems like a bit of a crazy thing, but it's something I think we've all experienced to some degree. And I note that the scientists from the Centre of Ocular Research and Education in Waterloo, Canada, have termed dry eye after the use of a face mask as mask-associated dry eye, or MAID, which is interesting. And Paulo, let's just get to the depth of what they're actually talking about here.
All right, just before I tell you what they're talking about, so dry eye can happen for two basic reasons. Either the production of tears has been reduced, so there's not enough tears, or otherwise the evaporation of tears has increased. Usually because the oil film that should be there is not there in sufficient quantity. Right. So there's those two possible reasons. Now, as you said at the beginning, masks were used so that our exhaled air doesn't go into other people, but it has to go somewhere. And in a mask that is sitting tight on your face, it's going to go upwards.
Right.
And depending on many different factors, as it goes upwards, it can dry the surface of the cornea. Okay. So it dries that film of tears that is always there, and that can lead to dry eye. But
now, in terms of patients who have pre-existing eye conditions or dry eye, is this just now an exacerbating factor?
Yes, this is an issue. So you've got patients with autoimmune diseases like rheumatoid arthritis, lupus, thyroid problems, okay? Patients that are on antihistamines, antidepressants, drugs for acne, for example, even contraceptives can have side effects as a dry eye. Then, of course, you've got menopausal dry eye disease, so because of the imbalance and deficiencies of steroid hormones after menopause, that can also induce dry eye, so those people will fare worse. People that spend a lot of time on digital screens.
It's pretty much all of us.
Or that work for long periods in air-conditioned environments. So yes, so if there are people who already had a problem, that problem will be exacerbated.
Right.
Yes.
And now we know that the reason, part of the reason for the moisture in our eyes is also a protective mechanism to eliminate things from going in through the membranes. So what sort of impact is that then having? Is it having an inadvertent impact on the spread potentially of disease because now we have dry eyes?
Yes, but I think the main reasons are the following. Because you have dry eyes, you will tend to, without thinking, touch your eye. Or you'll have to take your spectacles out in order to clean them or to let the mist disappear. Yes. And in doing that, you may touch your eyes or your face, your nose, with unclean hands. The other issue is that even if your hands are sanitized, you may be allergic to the substances in the sanitizer. So you touch your eye, you can cause an eye allergy. Yes. So there's all these potential situations, okay, which are aggravated by the use of a mask, which had to be done.
Now, Paulo, you mentioned the impact of screens and the use of screens on dry eye, which is exacerbated by the mask wearing. But this is not something that's specifically linked to the pandemic, the screens.
The digital screens, yes.
There's a pandemic of screen use, potentially, we could say as well. Yeah. Now, how is this impacting dry eyes across the board, regardless of COVID masks?
Well, that's a very interesting question. Research done just pre-COVID in India. They did research with 1.5 million patients, all right? And it was shown that due to excessive use of digital screens, dry eye disease was increasing. In fact, in India, they expect that by 2030, 45% of the urban population will have dry eye disease because of digital screens.
Right.
Which will make dry eye disease a larger disease than diabetes and heart disease.
It's quite scary because it's not as if we're getting in a place where we're going to use less screens. It seems like more and more we're heading towards that.
Correct, yes.
So are there practical things that we can do as screen users, if I can call us that, to eliminate dry eye without sort of any topical treatment, if I can use that?
Yes, there are practical things for anyone who has dry eye due to whatever reason. You should increase your intake of omega-3s in terms of diet, so fatty fish or a supplement. You should make sure you're not vitamin A deficient. So that means your diet should contain leafy green vegetables, orange and yellow vegetables, tomatoes, and eggs, for example. Then, of course, you should make sure that there's no air blowing into your eyes.
Okay.
All right, if that is at all possible. If you work at a computer, the computer should be as low as possible so that your eyelid is not more open, because the higher the computer, the more you've got to open your eyelids, so the more surface you expose for potential dryness. And of course, give up smoking, which is the same as saying give up breathing to most patients. So there are these few measures that you can take. That if you work in an air conditioning office, if you can also taking breaks from long tasks, where you are concentrating on something. So that all of that will help.
Okay. And then if natural or practical solutions are not helping, what would be the first sort of medical treatment that people are using?
Generally for dry eye, there are over-the-counter artificial tears. Okay, they can be used regularly. Usually they are thickish in terms of fluid. They can induce allergies in some people that are allergic to the components. They contain preservatives, which some people can be allergic to, and they can't be used with contact lenses. If dry eye is due to an infection or to an allergy, of course there are topical antibiotics and topical corticosteroids, but those are for short durations.
Yeah. So Doc, we've looked around and we've put into our Real Health Medicine cabinet Similasan's Dry Red Eye Relief, in fact. Now, what makes this different from the other topical solutions that you've mentioned to us now?
Well, Similasan is a Swiss company, so this is made in Switzerland. It's been in the market for over 35 years. It's an homeopathic preparation, so it basically works with the body for self-healing. All right. It contains belladonna and euphrasia. Now, it's very interesting. Euphrasia was known as eye bright in Europe in the 14th century. So already back then, it was used. It was dispensed. In fact, it was dispensed by doctors and pharmacists for all sorts of eye ailments until the advent of what we now call artificial tears, in a sense of modern Western medicine. It has no preservatives. It is very gentle. And it does not color contact lenses, for example.
So you can use it.
You could use it, keeping in mind that if your eyes are inflamed or infected, you should not wear the contact lenses to begin with. Ideally, if it is at all possible. But it can be used because it doesn't color the contact lenses. It has been subject to research, randomized controlled trials have been done, and it has been shown to be as effective as artificial tears that are available over the counter. And long-term use on the patients that have been followed, over 50% of patients found benefits. You know, keeping in mind that, remember that there is no magic in any one product. So depending on what you expose yourself to, there could be situations where, regardless of what you try and do, the exposure is of such a nature that you are not going to overcome the problem.
And something like this, Paulo, is it something that will work quite quickly when used, or does it take a bit of time to have an
it works very quickly. Generally speaking, it's 1 to 2 drops in each eye, and you can use it as often as you wish. It doesn't interact with any medication at all. It's got a fantastic safety profile, 36 years, I think.
And where can we find this product?
I believe it's available in health shops and pharmacies.
Wonderful. Thank you so much. As always, great to be chatting to you.
Thank you.